Thanks so much for joining our first webinar series. I'm extremely excited to be doing these. So the goal with these webinars is to teach quarterback biomechanics at an extremely high level. There's not a lot of information out there, so I wanted to teach this to anyone that wants to understand this better. First one we're going to start with is hip-shoulder separation. This is a key biomechanics thing to learn that really helps with velocity, accuracy, and timing. So this will help you throw an elite level. So what we're going to do, kind of how this is going to work, is I'm going to go through a slideshow in depth. Some of this is going to be physics heavy. A lot of this I'll break down and relate it to how it can impact you the most. If you have any questions as we're going, feel free to put them in the chat. The team will try to answer them as best as we can. I'll also have a Q&A at the end where we'll go over stuff in depth and I'll try to answer as many questions as possible. All right, so I'm going to switch over to slideshow. We'll get started on this. Okay, so first off, anyone who does not know me, my name is Joe Moore. I'm a quarterback coach. I am the founder of SpinLab AI, which is a biomechanics platform that gives everyone universal access to biomechanics. Why I think I can speak on this is I do have my doctorate of medical science degree. I have my master's of medical science. I have my CSCS. I have my PA license. I'm a licensed healthcare provider in 3 states. And I say all that just to give you background knowledge of what I'm speaking on today and what I'm going to speak on in future webinars is founded in a strict science and physics and biomechanics background. I'm not making any of this up. This is directly based in science. So if you have any questions as we go, that's what I'll try to answer it from. And if I don't know the answer, then I will also try to look that up for you guys. Okay, so getting started, what is hip-shoulder separation? Just an overview of this. So if we take the word, basically it's the separation of the hips and shoulders. So if you look over on this image right here, you can see as the hips rotate out in front, and the shoulders stay loaded back, then there's going to be this separation angle that gets created. This is with any overhead throwing athlete. So a lot of this stuff we talk about has been going on in the baseball world for a long time. We're just starting to touch on it in the football world. So it's that angle difference as you get the hips rotating out in front. The key part is that we'll talk about coming up in a couple slides is this creates elastic energy. So I get this potential energy from that separation that then can be used to snap forward and get some velocity during the acceleration phase. Next, let me show an image real quick. So I want to show video representation of this. What we're going to notice is this QB does a phenomenal job of being able to get the hips rotated out in front. So you can see hips already initiated rotation, and look how the shoulders are completely closed. So shoulder line's closed, loaded back. Hips have started rotation. As I play this through a little bit longer, you can see the hip is fully rotated, torso still stays closed. Then as that torso starts to load through, the hips stop rotation, energy goes through the torso and then out through the arm. So once again, it's hips first, separation angle gets created, torso then rotates through, and then arm snaps through. So we're offloading all that stress off the arm and we're relying on the hips and that separation to generate. Here's another one that I'll show you. This is with joint angles on it, so it makes it a little bit easier to see. Bear with me as we switch over to the images here. Okay, so this QB, what you can notice is as we start, so it's going to be very subtle, but you'll notice when they hit separation is going to be right about, let's see if I can slow this down a little bit more for you. So right about there, the hips are starting to rotate. You can see how that bar between the 2 hip joints is twisting, and the chest is still staying closed. So although playing this full speed through, it looks like there's no separation. You can see that subtle separation with the hips go first and the torso follows. All right, let's go back to the slideshow. Next 2 slides. So these are going to be pretty physics heavy. Try to stay with me as best as you can. If you want to understand the physics in depth, this is great for you. If not, I'll try to break it down and relate it to make it very simple to understand for why this stuff matters. So 2 key things I want to focus on. First one is what we call the stretch shortening cycle in physics and biomechanics. So what this is I have an analogy over here on a spring. If you can think of a spring, as I were to compress down on this spring, it stores all this energy for then when I let go, it snaps back forward. That's extremely similar to what's happening with your body with hip-shoulder separation when you're throwing. So your muscle, let me go back, or your fascial system, that gets pre-stretched. So as my hips start rotating forward, but my torso stays closed as this stage right here, where I'm compressing down that spring. And then as I let go, so as the torso starts to rotate forward, after that potential energy is created, I get the snap through and my torso and my arm accelerates through at high speeds. The actual physics equation is E equals half kx squared. So basically meaning your elastic potential energy equals the stiffness of that muscle or fascial system times the amount of separation or stretch squared. Now the squared part is the key part. So the more separation I can get within optimal range, too much can be problematic, can give me a lot more elastic potential energy, which can then be used for force. Second thing is angular momentum and torque. So angular momentum, just the rotational equivalent of linear momentum. And then torque is a force that causes rotation. So when we think about how this applies with hip-shoulder separation, so as those hips start rotating out in front of the torso, you get the angular momentum going in the hips, so in the lower half of the body, and then the torque gets loaded across the spine from that separation angle. So then as the torso comes through, same thing, we get rapid acceleration of the torso and the arm snapping through. So big picture item there is basically with both these systems, we're creating ways to get elastic potential energy. And then as we do that correctly, then we get all that energy that gets transferred into the torso and the arm. Okay, what are the benefits? So physics are great, but why is this important? Why is hip-shoulder separation a key thing for throwing athletes, including quarterbacks? Two big things I want us to focus on: offloading the arm. So can we take stress off the arm? Can we let the body generate the force here? So we're using the rotational torque and that separation angle to allow the rotation of the hips and torso to drive the throw. Then you can think about your arms just along for the ride. So rather than yanking my arm through and putting a lot of stress on my shoulder and elbow, it's my body generating force on the throw. Then the other thing is it enables proper sequencing. So we'll go over sequencing in depth in another webinar, but sequencing is absolutely essential for velocity, accuracy, consistency. Basically, any important metric with throwing is relevant with sequencing. What hip-shoulder separation plays into with sequencing is it creates that necessary delay. So as the hips get out in front, we want hips to reach peak velocity first in the torso. So it creates that good delay so then I can properly sequence as I go through. Okay, we're going to show another video here just so we can kind of recap this. Let me go back here. And this is going to be another QB that does a phenomenal job with this. So as we can showcase through, is as he goes through, you can see hips have started rotation. So let's go back. Hips are rotating, back hips rotating. Torso is completely closed. At this position, this is like our analogy of a spring. So that spring is getting compressed. All that elastic energy is stored. So then as the torso fires through, the arm whips through. So I'm going to play this through. This video is in slow motion, but I want you to see this is a quarterback that's extremely whippy. And a lot of that whippiness and that arm speed comes from the separation angle. So elastic energy gets stored. Let's see if this loads. We'll give it a second here. Might not want to play it through for me. I'll try to scrub this for you guys so we can keep it full go here. So as that gets created, that spring gets loaded, elastic energy stores, arm snaps through. So he's got great arm speed and velocity, but that's a result of that separation, being able to control that hip-shoulder separation and that sequencing throughout. All right, let's go back to this. Okay, magnitude or velocity, what is more important? So when you think about hip-shoulder separation, we have magnitude on one side. That is the degree of separation. So that's visually what you're looking at, is what is that angle difference between the two. And then there's also velocity. So velocity is how fast you separate. So that's something you can't see with the naked eye. That's looking for how fast that magnitude of separation was. How I like to think of this is magnitude is your gas tank, velocity is your timing switch. With that being said, what our data has shown and what the literature shows is that velocity might be a little more important. So we've had a lot of QBs where you have moderate magnitude of separation, but then when the timing is really well and you have high velocity, then you get a lot of velocity on the ball because you're using that energy properly. Where if the timing's incorrect, I can create significant magnitude, but if I can't effectively use that magnitude, then it does me no good. Sweet spot for what we see is you want moderate to high magnitude with well-timed velocity. That's where you're going to get the best results. Okay, convention of hip-shoulder separation. So first off, we're starting with magnitude. So if you look on the left-hand side of the screen, this is in degrees. and we're looking at this dotted pink line. That's our hip shoulder separation line. When we're at 0 degrees, there's essentially no separation. Positive value is going to be the hips are out in front of the torso, and the negative value is the torso is rotating out in front of the hips. So down here, negative, torso's out in front of the hips. Positive, hips are out in front of the torso. That's all I want you to know for now. Now, when we think about velocity, so this is now a velocity-based graph. So we're looking on the left-hand side of the screen in degrees per second. Same thing with the dotted pink line. Is with velocity, we think about a positive velocity is the hip shoulder separation is increasing. A 0 or right at that 0 line is peak separation or transition point. And then a negative velocity is the hip shoulder separation is decreasing. So the velocity of that, the torso is catching up. So hip shoulder separation velocity increasing, hip shoulder separation velocity decreasing down here, and 0 is that peak separation or transition point in terms of velocity. Okay, let's talk about kind of key parts of magnitude throughout the throw. So when you're looking over data or you're breaking down your throw in depth, this would be optimal. Is pre-throw hip shoulder separation is either 0 or slightly negative. So actually the hips are a little bit loaded back, so the torso is a little bit out in front. Once you hit foot strike phase, that hip shoulder separation rapidly increases as the hips start rotating. As we hit maximum external rotation of the shoulder, so maximum layback, typically is you want that to peak right at or right before maximum external rotation. And then during that acceleration phase, we're closing that gap. And then at ball release, we're getting it close to 0 as the torso catches up and the angle closes. So I'm going to show you a couple graphs here going over this. As we look at the left-hand side of the screen, we're trending this upper one first. So this quarterback starts negative, so hips are loaded back. As they hit foot strike, so foot strike is this first vertical line, you can see we're in slight positive value, so they are creating separation. As we go up here, this second vertical line is maximum external rotation, so they're peaking right before they hit maximum external rotation. And then as we're decreasing here, as the torso's catching up, ideally you would want this to be close to 0 at ball release, meaning we close that angle. They don't hit 0 till way after the throw right here, so torso finally caught up. And then torso decelerates a little bit more and goes back out in front of the hips down here. Same thing over here. So this quarterback does a little bit less separation at foot strike. So you can see we're basically 0 at foot strike. There's not a lot of separation going. They do hit peak kind of right before or right at maximum external rotation. And same thing, they're not doing a good job closing that gap. So as they hit ball release, hips are still out in front. They didn't adequately close the gap. Over one more time on the right-hand side of the screen is this QB's got good separation at foot strike, and they are climbing and rising well. And they do a better job closing. So we're getting closer to 0 right here. So this is a much better job of seeing how they can close that gap. And then afterwards, you can see they do a big where their torso continues to rotate really far past. That's going to be nuanced and varied. But main thing you want to focus on is at foot strike, am I starting separation with magnitude? Am I getting close to peak, close to maximum external rotation? And then am I close to 0 at follow through? All right, now velocity. So we've got to think about, we're talking about velocity and not magnitude here. So you've got to reframe your brain of thinking what I'm visually looking at. Right now we're looking at speed of separation. So it's nothing you can really look at with your naked eye. So pre-throw, you're around 0. So there's basically no velocity between the hips and torso. Foot strike, we're going to be positive and increasing, and the velocity peak is going to go around there. So even though the hips are continuing, the peak velocity peaks kind of closer to foot strike. Closer to maximum external rotation is when you're about 0. So that's when we're hitting that peak separation point and the velocity is switching. Acceleration phase, we're negative, and that angle of separation velocity is decreasing as the torso catches up. And then ball release, you want to peak negative around then, and then it starts, or peaks around ball release, right before ball release. Okay, so let's go over a couple graphs so we can kind of hammer this in here. So when we're looking at the velocity, we'll look at the left-hand side of the screen. You can see right before foot strike, so remember that's our first vertical line. This QB is already increasing, so there's increase in velocity of that separation. Peaks right about here. Then we get a decrease right at maximum external rotation, there's 0. And then the velocity is negative, so that means the velocity of closing that gap is increasing. So basically the gap's getting smaller, and then we peak right around ball release. There's other two here if you want to go over in depth, but it's the same concept is as I'm increasing I'm getting the velocity of that angle is increasing. As I'm decreasing, the velocity of that angle is decreasing. Okay, timing. So timing's key, and velocity is really important for overall velocity and power in the throw, but the timing has to be optimal within that velocity. And the key thing is when you're aligning that with maximum external rotation and ball release. So you want the positive peak of velocity slightly before maximum external rotation. So that means the separation gets built during early rotation. So the velocity, I peak early in that velocity, and then I have all that elastic potential energy stored as I hit maximum external rotation, and then I can use all that velocity to go through the torso and the arm. We want the negative to peak slightly before ball release, because that's indicating that the separation closed and then the energy gets transferred into the arm. So this is a good example. This QB, we're looking at velocity again. Over here, he's peaking before maximum external rotation. So separation was created quickly. We stored that separation well, and then as we hit maximum external rotation, torso's firing through quickly, that separation's closing, and then it peaks right before ball release. So right as it's peaking there, then that energy is getting transferred in the arm, which can snap off the throw. Okay, let's talk about mobility and stability. So you can't talk about hip-shoulder separation without these two key things. Essentially, you cannot separate your joints if you don't have good mobility and stability. And then once you have that, you have to have strength through that mobility also. But the big thing is if you don't have the mobility, no matter how much you know about this or how much you rep it or your coach is cueing you on it or you're cueing an athlete on it, is the body does not want to allow them to get into position. It's a very vulnerable position to be maximally separated, so you really need to address your mobility. I wrote a couple key ones here, but basically we're looking at overall mobility throughout the whole body is going to affect this. But when we're keying in on a couple things, back hip internal rotation. So this really allows the hips to rotate against the closed torso while that back foot remains grounded. So that's key to have good internal rotation in the back hip. T-spine rotation. So if we look on the right-hand side of the screen, that bottom image, we're looking at the thoracic spine. So that's T-spine. So basically how much I can rotate in that spine. You have to have really good rotation to be able to keep that torso closed while the hips get out in front, because that puts a lot of stretch across the torso and spine. And then stability needs. So lumbopelvic control, that basically means our lower lumbar spine, pelvic hip complex. So that whole complex at the bottom part has to be really stable to prevent early trunk movement and keep that trunk loaded back. And then oblique and glute coordination. So that anchors in the hips beneath and the glute stabilizes during that drive phase. So you have to be really good through both of those things. So here's an image of two quarterbacks doing this very well. So you can see how this puts your body in a very difficult mobility position. So left-hand image, his hips are completely turned and his torso still stay loaded back. So you can really see the stretch across this musculature right here. That's all that stored energy that gets fired through. His offside hand is working at that back pec. That's an extremely difficult position. This is about as good as it gets when it comes to mobility and stability, is to be able to have your hips fully, almost fully rotated and completely closed here, and to do that in a flow way, to not be able to have to yank that through, but to do that in a really natural way for the QB. Right-hand side of the screen is another really good example. This is a little more realistic until you get extremely good with mobility and stability of what a really good case looks like. So you can see hips started rotating and torso still completely closed. So you're starting to turn this back hip, hands on the back pec, and keeping that chest completely closed to start with. Okay, let's talk about common mechanical breakdowns with hip-shoulder separation. So what we want to think about here is one of the common things I see a lot is the torso opens too early. So essentially there's no separation. So right when you start your throw, the front side hand flies open, torso opens, there's no separation. So that's like if I had a rubber band, I never stretched it back. If I can prevent that torso from opening as the hips start, then I get that stretch in the rubber band, then I get the arm snapping through later. And then another thing is early over rotation of the hips. So the hips fly open, so there's no control and it pulls the torso with them. That's either poor stability, poor mobility, or that front side foot is not anchoring well and it's opening the toes all the way and the hips are over rotating with it. Late over rotation of the hips, So you can't close the gap and decelerate well. That means the hips continue to rotate and the torso never catches up. Arm dominant mechanics, just like it sounds. So there's very little rotational contribution of the trunk and hips, and there's no separation. So it's basically all arm dominant in the throw. And then unstable lead leg at foot strike. So that lead foot anchors you in place. If that's not anchored well and the toes aren't at a good angle to keep you anchored, then the hips don't rotate efficiently, especially if you don't step off midline, and that throws off all of the hip-shoulder separation to follow. Okay, we're going to show a couple images here, or a couple videos here, of some improper case, or some cases where the QBs can use a little bit of work here on this separation. So first one I want you to notice is this is a good example of the torso flying open prematurely. So you can see hand opens all the way. At this point, there's zero separation created. So hips and shoulders are at the completely same level. So there's no stored energy, no whip on this throw. Hips rotate late, very arm dominant thrower. Didn't create any separations, not utilizing rotational mechanics or torque into this throw. Other one here is, you'll notice it's a similar concept, except he does a decent job. So the hand stays closed, like my offside left hand is working towards his back pec and back armpit, but the hips aren't rotating. So torso started rotating, hips still have not rotated. Hips finally rotate towards the end as the torso is already open. So with this QB, they're okay separated. They got to get that front foot in the ground quicker so they can start the hip rotation in the back hip. Okay, let's go back to the slideshow. All right, then I want to talk about the role of the scapula and the rib cage. So this gets often overlooked when we think about hip-shoulder separation. So in order for the torso to stay closed, that scapula has to retract and glide. So this image over here is, let me go back, is when we think about retraction of the scapula, that's like I'm pulling my shoulder blades back. And then when we think about the rib cage, you want the rib cage to stay stacked. If I get in that position where I'm retracting and my scapula is gliding well and that rib cage is stacked, then I'm in a really good power position in this trunk to then generate that hip shoulder separation angle and then also to get the force with this. So this is often overlooked, but you can see a big difference in images here. So this QB on the left hand side doing a great job. Rib cage is completely stacked. It's a posterior chain dominant athlete, so they're stretched back here. And then as opposed to this right-hand side where chest gets way out in front, so rib cage is no longer stacked and they're getting way out in front and they're not retracted back adequately using that scapula and that transverse plane. Let's talk now about deceleration with hip-shoulder separation. So we think about it a lot of times with, we're creating that angle and we're getting velocity. We don't think about it as much with deceleration. So when I talk about closure of the gap, what I'm referring to is, if we look on the left-hand side of the screen, is at ball release, which is this third vertical line right here, this should be 0. So if I close the gap created, what that means is my hips decelerated properly to allow the torso time to catch up. So as I hit ball release, basically that gap's closed. It's not my hips are out in front and my torso's caught behind, or my torso's out in front. I want that to be as close to 0 as possible so the hips adequately decelerate and the trunk catches up. If we do this, so if the hips properly decelerate, that's where a lot of those QBs get a pop off the hand, so you really get the ball snapping off your hand. A lot of people that are losing that last little whip as they let it go is because the hips don't adequately decelerate, so you end up just kind of pushing the ball through rather than hip stop. All that energy goes up the kinetic chain, torso catches up, then comes off the hand. So it's a key thing is looking to see, can you get close to closing this gap on ball release? If you get within about 5 degrees, I'd say that's great. If you're sitting, 10 plus degrees, you got to do a much better job decelerating with the hips and getting the torso time to catch up. Okay, and then let's talk about role of hip shoulder separation with rhythm and tempo control. So another thing we don't think about a lot with hip shoulder separation is it does help control the rhythm of the throw. So if you can get that delay, so the hips start unloaded back with the torso, that gets a clean, whippy, smooth throw. So a lot of coaches saying this guy's a whippy thrower, or you got to be more whippy, but they don't tell you how to do that. A lot of that comes down to, are you creating any separation? Because if you're someone that immediately flies open that offside and there's no separation created, you're not going to be a whippy throw. It's going to look like you're pushing the ball or you're going to be very mechanical created. Then if I get early rotation going in the torso, then I'm going to be very rushed. I don't sequence well. So give that delay. The hips growing first, torso's loaded back. That's like that clean whippy throw. That's what I wrote here at the bottom. So large part of fluidity is that dynamic delay of keeping the torso close. Everyone wants to talk about flow state or fluid or smooth or whippy, but they don't actually tell you how to create that. So this is one key thing is if you're not doing this concept well of hip-shoulder separation, you're not going to be a fluid or a whippy thrower. Okay, here's what our data is showing. So I did pull in some data from SpinLab. So what I want to talk about was our velocity-based measurement. So this is peak hip-shoulder separation velocity. Our average is 224.5 degrees per second. When we start thinking about degrees per second, so 360 degrees per second means you can go in a circle in 1 second if you want help wrapping your brain around that. Puts you in the 75th percentile, so meaning you're better than 75% of the people that we've gotten data from. It's 266.4. 99th percentile, so you are elite, you're at the very top of our data points, is 446.1 degrees per second. Now I did talk in the beginning, it's not all about that peak number. That 446.1 only matters to me if you can control that and if you can time it well. So not just the peak, but you also got to look at, are you sequencing well? Is that peak happening at the right time? Go back to how we talked about the graphs and the velocity and everything. So although this gives you a snapshot and this is a good proxy for velocity and power on the football, it only is if you're using the timing right with it. Okay, how to improve hip shoulder separation. So all this stuff is great, but if you don't know how to improve it, then it doesn't matter much at that point, right? Here's what I do when I coach quarterbacks and when I look at quarterbacks is, number one, address mobility first. I can do all the cueing in the world. I can put them in the positions. I can do all sort of fancy drills and stuff. If they don't have the mobility, it's not going to go into place once we go live and we're going full speed with reps. Their body does not want to get in that position if they can't have the mobility to do it. These are very vulnerable positions, so your body's naturally going to protect when you go in full speed. So first off, do they have the mobility there? If they do have the mobility, do they have the strength through that mobility? So sure, they can passively create the mobility, but if they don't have the strength through that mobility, then it's not necessarily usable mobility. So getting strength through the mobility at that point. Once we have mobility, we have strength through mobility. Do they have stability? So in that lumbopelvic hip complex, are they stable with their rib cage and their core? Are they posterior chain dominant? All that stuff looks good. Then we got to train dissociation and control. So at that point, I'm taking through specific segments, both off the field without the ball and with the ball, specific drills that are getting them to teach their body to dissociate. So hips are starting, torso staying low back and closed. What we do with that is we either piece it together without the football, or if we're using a football, we're going to start slow. We're going to go about half speed. And then we're going to move on to stationary throws. With stationary throws, receivers 10, 15 yards away, and we're working it very heavily. We're very intentional with every single rep. So we're thinking about it. We're giving immediate feedback every single rep. We're recording and we're showing them every single time. Then after that is we're going to integrate it with dynamic throws. So we have to pass everything we've talked about first. So they got the mobility, they got the strength of the mobility, they got the stability, they know how to dissociate, they know how to control that dissociation. Then they're good at stationary throws. So now let's integrate dynamic throws. When we get to this point, this is where I don't want the quarterback thinking. I want you to go out there and let it rip. So let it fly. Don't do any thinking. Let me worry about that, because then I'm getting clips on the phone. We're looking over it later, and we're going to see where are the compensations, where are the energy links, why is stuff happening, why is it falling apart with the hip shoulder separation. So you got to understand that just trying to say I need to separate more or I need to separate better is one thing, but there's always a why behind it. So is it somebody that's not anchoring their front foot well? Are they not stepping off midline enough? Is their offhand flaring open? Are they not getting into retraction with the scapula? Is their pull going straight up and rotating and they're not sequencing well? So there's always a why behind it. The key part is figuring out that why. So if you go through everything else, and then once you go dynamic, it's still not sticking, there's got to be a why, that then you got to address that why afterwards. Okay, that's all I got for the slides. I'm going to open this up now for any questions anyone has. I would love the questions to mostly be focused on hip shoulder separation. We're going to do lots of webinars coming up in the future on different topics, but I'm happy to help answer any questions that anyone might have. Okay, let's start. So I had some people submit some questions beforehand. I'm going to go over a couple of that first. Like I said, you can put it in the chat if you have anything else that comes up. Question 1 was favorite drill for this. So like I talked about is first thing I'm looking at, mobility, stability. Let's assume all that stuff is great. And we're focusing specifically on drills at this point. One I really like to do to train people how to feel this is you have a PVC pipe on your back. So if I'm a right-handed quarterback with my left hand, I pin that PVC pipe against a pole, and then I'm firing my hips through. So the PVC pipe is keeping my torso delayed as I'm training that back hip to rotate and generate force. One thing you can do as that is you can lift off and then go back into the pole. So you're also training mobility through that, but it's the same concept of can I fire my hips through while the chest stays closed? That's number 1. And then on field drills with the football, one that I've noticed that really helps QBs figure it out and feel it out a lot is what we call a slow pull to fast finish. It's exactly what it sounds like. So I'm right here, I'm slow through my pull. And as I'm hitting that pull phase, as I'm going slow motion, I'm focusing on the back hip fires through, left side stays steady, and then I finish fast. The whole concept of that drill is can I get the back foot to turn as I'm still in that pull phase and as my offside staying close, I'm not letting it fly open. Other question we got was QB saying that it feels mechanical when they try to focus on this. Any tips with that? That is one thing I would be very cautious of is if you just go out on the field and you think about, or if you're coaching a QB and you're just trying to get them to fire it as quick as they can, it's going to be extremely mechanical. It's more of a stepwise approach. So first off, can you do it in the weight room? Can you do it without a football? And then slowly going into drills rather than I just get out on the field and I try to separate them as quickly as possible and as big as possible. So don't just go straight into it. Have a stepwise approach. Utilize the PVC pipe. Utilize the slow pull to fast finish. Address all the mobility and the stability first before you just try to kind of whip it through. Third one was, does this help with velocity and power? So this is one of the biggest things with velocity and power. Let's assume everything else is equal. So we got 2 quarterbacks. They have same force production, same overall strengths, same power. I would say hip shoulder separation and then sequencing and timing are 2 massive things that's going to kind of make or break you with velocity and power. So that is essential, and it's essential to have this in combination with the sequence. Sequence will be our next webinar, but if you have great hip shoulder separation and great sequencing, that's how we get that effortless velocity, and you're utilizing your body to throw it, so it's not putting all the stress on my shoulder and elbow essentially. Let me know if anyone else has any questions. You can drop them in the chat. Let me take a look over here. If not, if you have any questions that come up later, you can always submit those and I can try to address those in a follow-up email with everyone. But if you have anything that comes up, let me know. Let me see here. Give me 1 second. Oh, what exactly do we train through mobility? So first off, I would caveat this with I am helping athletes with mobility. If people truly have a mobility issue, then I would recommend they get with a physical therapist or a performance coach that specializes in that. But big thing I'm looking for, so hip mobility first off, T-spine extension and T-spine rotation. And then I have some drills I can share later. I can go over at a different time on specifically what helps with those, but those are kind of the big things that I'm focused on just in regards to the hip shoulder separation. We got one. Are you seeing any correlation with hip shoulder separation, velocity / magnitude, and throw velocity? Yes. The biggest one I am seeing, so let's talk about velocity first, is if you have high peak velocity, typically you have high overall ball velocity, like I said, if you equal out for all other factors in terms of size and force production. Magnitude is kind of a ceiling effect where if you have magnitude, it helps to an extent. Once you start to get excessive magnitude, sometimes with quarterbacks, it's not really giving you extra bang for your buck, and then it really makes things clunky and the sequencing gets thrown off. So definitely with good velocity is going to input on ball velocity, magnitude to a certain extent. let's see. Variations of med ball drills, good to work hip shoulder separation. That's a really good one. So I use med balls all the time with players, and I would think about it one of three ways. So we're working torso rotation, hip rotation, and then we're putting it all together. So anytime I'm working hip rotation, that's where I like more lateral throws. So I'm standing, loading into the back hip, throwing underhand into the wall. Then we got dynamic off of that, so I'm shuffling into it, or I'm loading onto that back foot and then rotating into it. With the torso, I try to get rid of the lower half. So essentially, I'm double kneeling or I'm sitting, and I'm just trying to get my torso rotating without my hips overcompensating. And then one that I like to do to tie it all together is just I fire. So I have guys get in position with the med ball like they're throwing, take the stride step, pause, fire the hips first while that torso remains closed, and then throw the ball into the wall. So it's a kind of a clunky separate one, but you just feel so stride, hip fire, torso stays loaded back, then fire the torso through. I would not include that in a warm-up routine. My philosophy with med balls is similar to other kind of plyometric or ballistic type movements. Is you want it a part of your weight program, but you want to make sure you have rest days in between. So especially if you're doing the exact same med ball throws, try to get some rest days in between that. I would do that more with your weight room stuff than I would prior to throwing. Question, common compensations you've seen with guys with mobility issues. Biggest one I see is if you don't have the mobility to keep your torso closed while the hip fires. Like me at this stage in life, I have poor mobility, so it hurts if I'm really cranking my hips through and my torso stays closed. So if a lot of guys don't have great mobility in that T-spine, they're just going to flare the offside early. And if that's someone that like you're cueing them or you're a QB and you're focusing on this nonstop on keeping my offside back, but for whatever reason when I go full speed, that offside flares open right away, typically that's probably an indicator of either T-spine rotation is not good or you have really bad hip mobility. So to compensate and to not put my body in that vulnerable position is I'm just going to flare open and kind of push them all together at one point. Let me know if anyone else has any questions here. How do you feel with the belief that it is bad to work mechanics in season? I might have a little bit of a unique response that some people might not expect with me being a quarterback trainer in biomechanics is I would agree that you should focus heavily on massive changes in terms of fundamentals and mechanics in the off season. During the season should be tune-ups and more game-like movements, problem solving, getting guys feeling good and making small tweaks. But massive changes, I would agree, should not happen during the season. That should be in the off season, because likely what happens when you make a big change, like anything in life, is for an initial bit, it's going to feel worse and it's going to go downhill before it gets significantly better. So I would say right now is perfect time for it. As you start to head into August, I would not make any massive changes and more just be cleaning stuff up. One thing I did want to add for any coaches that are on this is I am starting what I'm calling a coach's corner, which is just a separate community where we can share ideas, bounce ideas off each other, talk about all things QB. So if you're interested in that and you're a coach, shoot me a message on email, Instagram, Twitter, and I'll get you signed up for that. Sorry for the players, that's just for coaches right now. I'll give this about another 20 seconds. We're going. Anything you have seen with your injury risk assessment in oblique strains with high positive or negative hip shoulder separation velocity? That's a really good question. In terms of, since we just started it, no, I have not. With my, if I take off my quarterback hat for a second, I'm thinking more as a healthcare provider, I would completely, I would agree if there's a high velocity with, or I would speculate if there's a high velocity with a high magnitude, that I would see some guys that have that. And you did just kind of spark something in my mind where I was just working with a guy recently that does get a little bit of oblique issue, and that's someone that separates extremely fast in that separation. So I don't have any data to back up my claims, but I would say if you're someone that gets a high magnitude and high velocity, I could see how that that would play out. And I'm happy to share that information once we get a lot more uploads into that injury risk calculator. I'm tracking that more over time. Last one. Here, we'll go one more right here. What degrees of magnitude do you start to see diminishing returns? I've seen the number 30 degrees as a suggested max. 30 degrees. So what I would say is QBs is kind of uncharted territory. So we're trying to give global access to biomechanics. Has not been a lot of stuff done before, and not looking at certain metrics like that. Baseball has years and years of data, and baseball players are going to get a much larger angle of separation. What I've seen with our data so far is most guys are not getting close to 30 typically in that separation angle. Some guys that are extremely mobile and whippy might get close to that, but typically we're in the 10 to 20 range, especially at that more kind of foot strike to maximum external rotation transition point. Usually I'm not looking at a particular number with this. I'm more looking at kind of what I'm visually seeing. So if guys are getting real clunky where they're just kind of ripping through and compensating, like they're leaning or their hips are getting out in front, then that's someone who's trying to create too much of a magnitude with that. I try to more so train players outside of throwing and with kind of all the mobility, stability, and strength stuff, so they don't have to think about when they get on the field of just kind of cranking it through. But that's my long-winded answer to, I would say the number 30 is probably not relevant for quarterbacks at this point, and we'll probably get more clear numbers in the next couple months once we get a lot more measurements going. Okay, so I will stop it there. I'll send a recording of this webinar to everyone who registered, so you'll have that. I will, if there's any other questions that come in, feel free to shoot them to me later. I can always try to answer as much as I can and send those to people if I can in the future. Really appreciate you guys. Thank you so much. Looking forward to doing more of these in the future.